Speaker, I seek unanimous consent to bring forward a motion requiring the government to implement paid sick days legislation to help protect workers across Ontario from COVID-19 so no one has to make the difficult choice between staying home when sick and being able to pay the bills.
Leader of the Opposition is seeking the unanimous consent of the House to move a motion. Agreed? No. Heard a no. Leader of the Opposition.
Thank you, Speaker. I seek unanimous consent to immediately pass private member's motion 152, calling on the Ford government to revoke Regulation 298/21 and the unprecedented and potentially unconstitutional powers it has extended to Ontario's police services.
The opposition is seeking unanimous consent of the House to immediately pass private member's motion 152. Agreed? No. Heard a no. Leader of the Opposition.
Thank you, Speaker. Speaker, I seek unanimous consent to immediately pass private member's motion 153, calling on the Ford government to implement paid time off for vaccination, helping facilitate the timely vaccination of Ontario's workers as part of the fight against COVID-19.
We are seeking unanimous consent of the House to immediately pass private member's motion 153. Agreed? No. Heard a no. Leader of the Opposition.
Speaker, I seek unanimous consent to immediately pass private member's motion 154, calling on the Ford government to implement a full shutdown of Ontario's non-essential businesses where the risk of COVID-19 spread is high and extend adequate financial supports to help the workers and businesses impacted by the interruption.
Leader of the Opposition is seeking unanimous consent of the House to immediately pass private member's motion 154. Agreed? Heard a no. Leader of the Opposition.
Speaker, I seek unanimous consent to immediately pass private member's motion 136, calling on the Ford government to provide financial assistance for small businesses not eligible for other supports during this pandemic.
The Opposition is seeking unanimous consent of the House to immediately pass private member's motion 136. Agreed? Agreed. Heard a no. Member for Don Valley East, on a point of order.
Speaker, I seek unanimous consent to move a motion regarding the immediate passage of Bill 247, the Paid Personal Emergency Now Act.
Member for Don Valley East is seeking unanimous consent of the House to move a motion to immediately pass Bill 247. Agreed? No. I heard a no. It is now time for oral questions. I recognize the Leader of Her Majesty's Loyal Opposition.
Thank you so much, Speaker. Thank you so much. Speaker, right now in Ontario's ICUs, there are some 770 or so patients, people with COVID-19 who are literally struggling to breathe. Ontario is in an absolute crisis with this virus. Yesterday, against all evidence, the government claimed that they were following expert advice from the science table and from other doctors and experts about how to handle this crisis. And of course, we now know that Dr. Lowe has in fact started to shut down businesses where COVID-19 is spreading. If, as the Premier claims, all of the appropriate measures are already in place in Ontario to stop the spread of COVID-19, why did Dr. Lowe then have to take the action that he decided to take today?
The Minister of Labour, Training and Skills Development.
Well, thank you very much, Mr. Speaker. Of course, we saw the news this morning with the local decision by Dr. Lowe. We're working closely with public health, but I have to say, Mr. Speaker, we are truly disappointed with the federal budget that we heard yesterday. In fact, the federal government worked with the provinces at the beginning of this pandemic to ensure that job-protected leave was the responsibility of the provinces. That's why we moved forward, the first in the country, to ensure that there was job-protected leave, including job-protected leave for those who are getting vaccinated. And the federal government was going to step up with paid sick days. Mr. Speaker, $100 billion more in new spending federally, no improvements to the sick pay program, but I want every worker in the province to know that we have
response. Next, or the supplementary question.
Mr. Speaker, Dr. Lowe, the Peel Medical Officer of Health, actually had the courage to do today, what the Premier has not had the courage to do. He's filling literally a leadership void that's been left by the Premier of this province. The members of the science table and other experts are speaking out. And in fact, Nathan Stahl, science table member, said this: "Another heroic move by Dr. Lowe." Oh, that we could have a heroic move from our Premier, Speaker. Member of the vaccine task force, Isaac Bogoch, said this: "This will really help." Speaker, now that Dr. Lowe, the Peel Medical Officer of Health, has done the right thing, has chosen to act to save lives, will the Premier step up and provide direct financial support to the businesses impacted and the workers impacted by Dr. Lowe's courageous and correct decision this morning?
Thank you very much, Mr. Speaker. I appreciate the question, but to be clear, this is an authority that the Chief Medical Officer of Health of Peel has had since well before the beginning of this pandemic, Mr. Speaker. As the Minister of Labour just highlighted, of course, we are disappointed that the federal government did not extend further protections to workers. It is something that we will look at. It is, of course, something that the Minister of Labour has just said, that it is important to ensure that workers who are infected with COVID, that they know that we will we have their back, Mr. Speaker. But as I said, look, ultimately this is a power that the Chief Medical Officer of Health of Peel has had for since the beginning of the pandemic. With respect to supports for businesses, I note that the Leader of the Opposition and the NDP provided absolutely zero amendments to the budget bill that was presented by the Finance Minister, Mr. Speaker. They had an opportunity to provide amendments. They instead supported that bill, and I congratulate them for it.
The final supplementary.
Speaker, Dr. Lowe in Peel had to step in because the Premier marched us right into this third wave with his eyes wide open, and he is now marching us in the wrong direction. He continues to march this province in the wrong direction. All of the experts are saying the same things. His own experts, doctors, nurses, people on the front lines of the healthcare system are all very clear. What essential workers need is vaccines, not spot checks. What they need is paid sick days, paid time off when they're sick, and to get vaccinated, not playgrounds being closed. Speaker, will this government do their job? Finally do the right thing by Ontario's workers. Listen to the advice of experts. Save lives. And do what's necessary to stop the spread of COVID-19.
And to reply, the Minister of Labour.
Well, Mr. Speaker, getting needles in arms is the top priority for this government. I'm proud to say, Mr. Speaker, that 25% of adults in this province have now been vaccinated. We need to do everything to ensure that we get more vaccines delivered here to the province of Ontario, to ensure that those essential workers, that everyone in the province of Ontario gets vaccinated. That's how we're going to move to defeat COVID-19. But, Mr. Speaker, the responsibilities of the province and all provinces and territories was to ensure that there was job-protected leave. That was the agreement. The federal government was going to step up with paid sick days for workers. Mr. Speaker, they spent in new spending more than $100 billion yesterday, and not even a fraction to deal with the concerns that Ontario has been raising when it comes to protecting the health and well-being of workers. But, Mr. Speaker, I want to assure every worker out there that we have their backs and we're going to be there for them until we defeat COVID-19.
The next question. Once again, the Leader of the Opposition.
Speaker, it's clear to workers that their government has abandoned them in the fight against COVID-19. Their Ontario government, Speaker, their Ontario government has abandoned them. But look, I want to ask another question of the Premier. And the question is to do with the postal code hotspots that were identified by the government that are priorities for vaccinations. They claimed that the decision that they made last week was directly from the advice of their science table recommendations. So my question is, did the government actually implement the recommendations on the hotspots that came forward from the science table? Yes or no?
Deputy Premier and Minister of Health.
Yes, we did receive recommendations from medical experts on the identification of the hotspots. Some of the hotspots we didn't proceed with because we needed to take into consideration other information such as hospitalizations in the past, ICU admissions in the past, unfortunately deaths in the past, vaccine hesitancy, issues with respect to language, socioeconomic issues as well, barriers that were preventing people from coming forward to receive the vaccinations. So yes, we did receive the information from the medical experts. We then added to it the additional information, which was what ultimately ended up in the postal codes that were identified as hotspots that we are dealing with by allocating 25% of the vaccines off the top to fight COVID-19 in those hotspots for the benefit of all of the people in Ontario.
Supplementary question.
Speaker, today's Toronto Star has a headline that says this, and I quote, "Ontario ignored its own science table's advice on several COVID-19 vaccine hotspot postal codes." 5 higher-risk postal codes were taken off the list, and 8 lower-risk areas, most of which are in PC ridings, were added to the list. In fact, Dr. Anna Banerjee said this on that decision, and I quote, "Someone's intervening. It's not based on science and evidence." My question, Speaker, is who changed the list, and will they change it back?
Minister of Health.
Thank you very much, Speaker. And what I would say to the Leader of the Official Opposition, through you, Speaker, is somebody's talking about something they know nothing about. And in fact, what happened is what I indicated in my previous answer, that the medical experts at the science table gave us some information about postal codes that they thought should be identified as hotspots. We then took that list, which was then presented to the Vaccine Distribution Task Force. We added additional information, such as the socioeconomic data, the barriers that existed to people receiving vaccinations, because we want to make sure as many people receive the vaccinations as wish to have it. We wanted to make sure that we could identify those hotspots, work with community agencies to bring people in for those vaccinations.
Response?
And that is how the information resulted in the hotspots that were identified by our government as the areas where we should put the additional 25% of those vaccines going forward.
Order. Final supplementary.
Speaker, lives are at stake here in our province. The ICUs are filling up. They're full. They're full of young people, Speaker. They're full of pregnant women. They're full of entire families who are sick with COVID-19. What we need is vaccinations going to all of the hot spots, Speaker. We need paid sick days and paid vaccination time off so that people can keep themselves and their co-workers well. We need strong public health measures in our province. All of the experts have been giving this government the exact same advice. The science table, the vaccination table, everyone is telling the government, frontline doctors and nurses and healthcare workers who are exhausted and terrified are giving the government the same advice.
Question.
So when, instead of listening to the anti-public health and the anti-science wing of the PC caucus, will this government actually listen to the experts, the scientific experts who are giving them advice?
Thank you, Speaker. Since the start of this pandemic, our government has been guided by our world-class public health experts who have been providing us guidance to safeguard the health and well-being of all of the people of Ontario. We know that we need a balanced and straightforward approach. We've been listening to all of the experts. For example, the COVID-19 Health Coordination Table is led by Dr. David Williams, our Chief Medical Officer of Health, by Helen Angus, the Deputy Minister of Health, and by Matt Anderson, the President and CEO of Ontario Health. This table reports directly to the Ministry of Health and includes representation from other ministries as well, from long-term care, from Children, Community and Social Services, Seniors and Accessibility, and Solicitor General. We've also received modelling that has been extremely helpful in guiding the way for our government to take the steps that we have related most recently to the declaration of the state of emergency and stay-at-home order. We have always followed the advice of our medical experts and will continue to do so until we are out of this pandemic.
The next question, the member for London West.
Thank you, Speaker. My question is to the Premier. Speaker, everyone but this government understands the urgency of paid sick days to protect lives in Ontario. They claim it's not their responsibility, which we heard yesterday and again this morning. They attack the federal government for not tweaking the federal program, acknowledging what we all know, that the federal program isn't adequate for workers who need paid sick days. The Finance Minister said in this House yesterday, and I quote, "We also need to protect essential workers who need to keep working during this crisis." Speaker, why does the Premier and his Finance Minister ignore all the evidence that the best way to do that is to bring in paid sick days for Ontario workers?
Minister of Labour, Training and Skills Development.
Mr. Speaker, we've been advocating for months to improve the federal sick pay program. Mr. Speaker, that's why we reached out months ago and urged Minister Qualtrough. I know the Premier talked to the Prime Minister to ensure that payments got into workers' bank accounts faster. Now payments are between 3 and 5 days. We advocated for greater flexibility. We advocated to fill in the gaps of this federal program. But, Mr. Speaker, there was a budget yesterday in Ottawa. We wanted to see our borders protected, more secure borders. We wanted to see more vaccines for the people of this province. And, Mr. Speaker, we wanted to see an improvement in the paid sick leave program by the federal government. But let me assure all workers in this province that we will be with them. Together, we're going to defeat COVID-19, and we've got their backs.
Supplementary question.
Speaker, instead of expecting a sick worker to go without pay while applying for a program that doesn't replace their full wage, instead of attacking the federal government at every opportunity, this Premier should be focused on getting Ontarians the supports they need. Speaker, paid sick days would mean workers who get sick would get automatic, seamless support from their employer. It would mean essential workers would know their province has their back. When workers can stay home if they're sick, they protect their colleagues, their families, and the whole community. Will this Premier stop blaming the federal government, stop his ideological opposition to paid sick days, and bring in a program of paid sick days just as health experts recommend and workers desperately need?
Minister of Labour.
Well, Mr. Speaker, we were the first jurisdiction and one of the first in all of North America to bring in job-protected leave for any worker in self-isolation, in quarantine. If they're home looking after a son or a daughter because the schools are closed, you can't be fired for that. Mr. Speaker, we were the first jurisdiction to bring in job-protected leave for anyone who has to get a vaccination. And Mr. Speaker, it was 2 weeks ago that the NDP government in British Columbia reached out to us to figure out how to bring in job-protected leave for those getting vaccinated, and of course they moved yesterday. But, Mr. Speaker, it was the federal government's responsibility. That was the deal with all territories and provinces in the beginning to bring in paid sick days for every worker. There are gaps that exist. Mr. Speaker, the federal government did not move yesterday, but I can assure workers out there we've got their backs.
Thank you. The next question, the member for Flamborough-Glanbrook.
Thank you, Mr. Speaker, and good morning. Mr. Speaker, my question is to the Minister of Finance. In my riding of Flamborough-Glanbrook, people recognize the importance of protecting workers and keeping them safe during this pandemic, and that is why I'm very proud this government passed legislation at the start of the pandemic creating job-protected leave. This leave ensured no worker would lose their job if they stayed home to self-isolate or to care for a loved one. Mr. Speaker, that was just the beginning. Premier Ford joined our federal and provincial partners in signing an historic $19 billion Safe Restart Agreement, which included $1.1 billion to provide Ontario workers with 10 paid sick days. Mr. Speaker, this government has continued to ask the federal government to make improvements to the Canada Recovery Sickness Benefit. Yesterday, the federal government's budget was an opportunity to introduce improvements. Can the Minister of Finance tell this House why the federal government needs to amend the Canada Recovery Sickness Benefit to support all Ontarians?
Recognize the Minister of Finance to respond.
Thank you, Mr. Speaker. First off, I'd like to thank the member from Flamborough-Glanbrook for that excellent question, and I thank her for being a strong advocate in her community. Mr. Speaker, our government's advocacy for Ontario has delivered real, meaningful support for people and employers across our great province. Mr. Speaker, working closely with the federal government, this Premier has already successfully negotiated 20 additional paid sick days, starting from 10 and doubling it to 20 as improvements to the speed which workers receive their sickness benefits. Mr. Speaker, for months, Ontario has continued advocating for additional improvements to the Canada Recovery Sickness Benefit and to protect Ontarians' health and that of their co-workers when they are ill or worried that they may have COVID-19. Workers need to know they have immediate access to this program. Mr. Speaker, the government will continue to fight for Ontarians and the recovery sickness benefits they deserve. I hope all members of this House will support our efforts to protect workers in Ontario.
Supplementary question.
Thank you, Mr. Speaker. It's great to hear the Government of Ontario continues to advocate to improve this very important benefit. Members of my riding will be happy to know that they can apply for up to 20 paid sick days using the Canada Recovery Sickness Benefit and expect payments in only a few days, thanks to the work of this government. Mr. Speaker, we have heard that the province has successfully negotiated improvements to the benefit already. We know the federal government is aware of this. Government's request to amend the benefit to provide immediate access to relief for workers. Mr. Speaker, yesterday's budget was the right opportunity for the federal government to show support for workers right across Ontario. Can the Minister of Finance tell us why the federal government decided not to improve access to paid sick days for all workers in Ontario?
Minister of Finance.
Again, thank you, Mr. Speaker. Thank you for that important question. The federal government shares our commitment to protecting people from this virus and beating this pandemic once and for all. And I would like to take this opportunity to congratulate Minister Freeland on the release of Budget 2021. However, Mr. Speaker, as the COVID crisis intensifies, we are disappointed to see that there was no action announced in yesterday's budget to the Canada Recovery Sickness Benefit. Mr. Speaker, every member of this House needs to stand up for the workers in Ontario, and this government continues to fight hard for improvements while other members of this House play politics with the health of Ontarians during a pandemic. Mr. Speaker, I, along with our entire government, remain steadfast in our promise to protect all workers.
The opposition will come to order.
We will continue to advocate on behalf of Ontario and push for the changes to the Canada Recovery Sickness Benefit all Ontarians expect and deserve.
The opposition will come to order. The next question, the member for Brampton Centre.
Thank you, Speaker. My question is for the Premier. For months, experts, including members of the Premier's own science table, have been sounding the alarm about dangerously high ICU levels. And today we learn that there are over 760 people fighting for their lives in Ontario ICU, Speaker. But the Premier failed to act. They failed to implement paid sick days. They failed to vaccinate workers in hotspots. And now ICUs in communities like Brampton are overflowing. Pediatric hospitals are sacrificing their beds. Patients are being transferred to hospitals around the province outside of their communities, Speaker. And doctors and nurses are being put in the horrific position of having to make decisions on who will receive life-saving supports and who will not. Speaker, why? With all of the evidence in front of this government, all of the warnings from their own science tables and medical experts, does this government continue to ignore the crisis in our ICUs?
Minister of Health.
Thank you very much, Speaker. Well, we have been listening to the experts all along. We have been listening to their evidence. And I think one thing is really important, Speaker, and I would say to the member opposite through you, that the Speaker is alleging that there is a triage protocol in place in Ontario. There is not. There is not. That is something what we are doing is building capacity in our hospitals. We are making sure there's two aspects to what we need to deal with here. We need to blunt the transmission of COVID-19 in communities, as well as right now we need to build capacity in our hospitals, which we are doing. We are in contact with the CEOs of the hospital on virtually a daily basis. They are working very hard to create spaces. We are creating capacity so that everyone in Ontario who needs to be admitted to hospital and needs to be in an intensive care bed will have a bed available for them.
Response? Supplementary.
Mr. Speaker, with all due respect to the Minister of Health, that response shows us how out of touch with reality this minister is. Doctors are sounding the alarm bells, and this government continues to ignore their pleas for help. The government is following a pattern of denying the problem and acting too late. Now the government is begging other provinces for help, but refusing the federal government's assistance and the assistance of the Red Cross, Speaker. Speaker, healthcare systems in other provinces are also fighting COVID-19. They need their healthcare workers just as much as we do. It was this Premier's responsibility and this Minister of Health's responsibility to help protect people here in Ontario, and they failed to do that at every step of this pandemic. This is a national and global failure, Speaker, and it is upsetting and heartbreaking to know that they could have acted and they chose not to, Speaker.
Question.
With months to plan for this crisis, why did this Premier fail to address the issues causing ICU capacity to rise, and why does this government think it's another government's responsibility to come and clean up their mess?
House members to please take their seats and allow the Minister of Health to reply.
Thank you, Speaker. And again, through you, Mr. Speaker, I would say to the member opposite that what you're suggesting is simply not the case. Since the beginning of this pandemic, we have been working hard to make sure that we have both the health human resources and the physical capacity in order to deal with what's been happening. We have created, I don't know if the member opposite really wants to hear me.
I'm going to ask the Minister of Health to take her seat. I'm going to ask the member for Brampton Centre to come to order. I'm going to ask the Government House Leader to come to order. Always innocent. I'm going to recognize the Minister of Health to conclude her response.
Thank you, Speaker. To continue, since the beginning of this pandemic, we have created over 3,100 new hospital beds, which is the equivalent of 6 new community hospitals. We have also added 14% to intensive care capacity, which is significant in the context of this pandemic. We have also added resources in order to be able to deal with the health human resources that we need. We have allowed for the deployment of people from one sector to another. And finally, I would say with respect to what's happening with other provinces and other organizations coming in to help us, we're very grateful for the help that's being offered by the other provinces, and we're very grateful to the federal government for their offer of assistance from the Red Cross as well. We know that we need help right now. We have the physical capacity.
Response?
We need some more health human resources, and we are using those resources to make sure everyone who needs help will get help in our hospitals.